Dear students, today our lecture about morphological and functional features of the skin in children. The skin and mucous membranes of infants and young children characterized by increased sensitivity. As a result of insufficient melanin production in newborns, the skin is initially lighter. The granular layer is weakly expressed. There is no keratohyalin. The skin is transparent. The epidermis is renewed in 30 to 36 days. The stratum corneum is thin, and keratinization is directly related to vitamin content in the food. Insufficient amount of elastic connective tissue and muscle fibers. The capillary network, which is located in the papillary layer of the dermis, is well expressed, so we have a rich blood supply. At birth, the skin surface is covered with a secret. Bactericidal activity of the skin is low because the pH of the skin is neutral, pH 6. During the first months of life, the pH decreases and becomes acidic. So the bactericidal activity of the skin increases. Due to low bactericidal activity of the skin, we have many infection processes of skin in newborns. For example, omphalitis. The skin of children is rich in water. At birth, it is covered with a fairly thick layer of cheese-like grayish-white lubricant, vernix caseosa, which consists of fat, flat elements of the epidermis, contains a lot of cholesterol, glycogen, and aniline. On this picture, you can see vernix caseosa in newborn. The skin is an indicator of the age of intrauterine development. So, skin furrows on the soles appear at 32, 34 weeks in the upper part of the sole and go transverse. About 77 weeks, the furrows occupy about 2/3 of the foot, mainly in the upper parts. Up to 40 weeks, the entire foot is streaked with furrows. Full-term baby, for example, on this picture. Fluffy hair, lanuga. From 20 weeks of intrauterine development, it covers the entire body of the fetus. From about 33 weeks, it gradually begins to disappear, first from the face, then from the trunk and limbs. Up to 40 weeks, fluffy hair remains only in the area of the scapulars. On this picture, you can see lanuga. Features of the skin function in newborns. In newborns, the protective function is imperfect. Bactericidal function is low. Thermoregulatory insufficiency. Respiratory, depositing, resorption, receptor, metabolic function well expressed. Enzymatic insufficiency. Excretory function is also insufficient. The pigment-forming function is not formed. The synthesis of vitamin D and other biologically active substances is weakened. Secretory function of the sebaceous glands is increased. Examination. Skin color changes. Pallor of the skin in healthy children is observed with constitutional hyperpigmentation of the general cover, or with deep placement of the skin capillary network, excessive deposition of fat in the skin, spasm of the skin vessels. And pallor can be observed in anemia, kidney pathology, acute pain. So, pallor may be physiological and may be pathological. You can see pathological changes, pallor of the skin in babies. Hyperemia of the skin in children. Redness, contact dermatitis, and baby with diathesis. Redness also may be physiological and pathological. In newborns, physiological hyperemia of the skin is associated with a significant diameter of the skin capillaries, a very thin epidermis, and a transient hyperthermia. Redness is observed after the influence of heat, UV radiation, when using vasodilators as a result of excitement and shouting. In polycythemia, as a result of significant increase in number of red blood cells and the high content of hemoglobin, the skin becomes blue-purple. On this picture, you can see baby with pathological hyperemia and pathological bluish cyanosis in some congenital heart disease, for example, Fallot tetralogy. Jaundice also can be pathological and keratohyalin. Jaundice can occur in healthy children when eating excessive amounts of vegetables and fruits that contain carotene. Carrots, tomatoes, oranges, tangerines. Correcting jaundice. Maybe jaundice due to high level of bilirubin in children with hepatitis, bile duct atresia, hemolytic anemia, conjugation jaundice. On this picture, you can see baby with carotene jaundice. Inside children, jaundice can be only on the skin, not on mucous membrane. Jaundice of the newborn, physiological jaundice. Hemolytic disease of newborn, pathological jaundice. Bluish color of the skin can be only pathological. Cyanosis of the fingers, earlobes, and lip mucosa is observed in the pathology of the cardiovascular system. With general cyanosis, you should think about acute respiratory disorders. Superficial veins are detected in rickets, hydrocephalus, portal hypertension. Total cyanosis in baby with severe pneumonia. Acrocyanosis in child with congenital heart defect. Superficial veins in a child with hydrocephalus. Rashes. This is the local inflammation of the epidermis and dermis with the color changes and swelling of the skin as a manifestation of a reaction to the causative agent of the disease or its toxic products or allergen. Characteristics of rashes. When identifying rashes, you should pay attention to localization of rash elements, their number, dimensions of individual elements, form, edges of the rash elements. Rashes in child with meningococcemia. Primary elements of the rash. What is a primary element? A rash that appears on unchanged skin. Roseola is a pale pink spot with a diameter of 1 to 5 millimeter, round or oval in shape, which does not rise above the surface of the skin. When the skin is stretched, roseola disappears without a trace. It is absorbed in typhoid fever, typhoid fever, paratyphoid fever, maybe in scarlet fever. The spot macula differs from the roseola with size. Small spotted rashes, their diameter is 5 to 10 millimeter. Large spotted, 11-20 millimeter. They are irregular in shape and are a constant symptom of rubella, measles, and drug allergies. Baby with measles. Erythema is a large area, more than 20 millimeter, of hyperemic skin of irregular shape, most often found in the face. For example, erythema in baby with contact dermatitis. Papilla, a limited, slightly elevated formation above the level of the skin with a flat or damped surface. It is formed as a result of exudation and local infiltration of the skin by cellular elements ranging in size from 1 to 20 millimeter. By the size divided into miliary, 1 to 2 millimeter in diameter, lenticular, up to 5 millimeter, nummular, 10 to 20 millimeter, papillas of large size, more than 20 millimeter, called plaques. Papillas leave behind pigmentation and pinning. Baby with rubella. Hemorrhagic rash. Hemorrhagic rash differs from spots in a darker color, does not disappear when pressed. Petechia, 1 to 2 millimeter in size, purpura, up to 5 millimeter, and ecchymosis, more than 5 millimeter. Very typical for hemorrhagic vasculitis. Blister, urtica, is an Iceland inflammatory element that occurs as a result of limited edema of the papillary layer of the skin, rises above the surface of the skin, has a rounded shape with dimensions of 20 millimeter and more. This element involves quickly, leaving no trace behind. The appearance of a blister is accompanied by itching. Urticary rashes are characteristic of allergic dermatosis. Vesicle, a superficial protruding above the surface of the skin, filled with serous or bloody fluid. A formation of 1 to 5 millimeter in size, which can dry out with the formation of transparent or brown crust, with a limited wet erosion appearing at the break. After the crust falls off, temporary hyperpigmentation remains or disappears without a trace. Very typical for chickenpox. Bubble, bulla, an element similar to a vesicle but larger in size, from 3 to 15 millimeter or more. It is located in the upper layers of the epidermis and under it, filled with serous, bloody, or purulent contents. It leaves behind crusts and pigmentation. It occurs with burns, acute dermatitis, herpetiform dermatitis of during. Secondary elements of the rash appear after the primary ones. Squama, accumulation of horny plates of the epidermis. Flakes can be of different size from 1 to 5 millimeter. More than 5 millimeter leave live exfoliation. They are yellowish or grayish in color. Flakes appear after measles, scarlet fever, psoriasis, and seborrhea. Gneiss. For example, squama in girl with psoriasis. Krusta, a secondary element that is formed as a result of the drying of exudate bubbles, pustules, blisters that are released from wet surfaces. The crusts can be cirrhose, transparent or grayish, purulent yellow, and bloody brown. Crusts that are absorbed on the cheeks of the children, for example, with exudative-catarrhal diathesis, are called milk scab. Milk scab in babies with diathesis. Ulcer, ulcus, is a secondary element of rashes, which is characterized by the presence of a deep skin defect that sometimes reaches the underlying organs. Cicatrix is a secondary element of rashes, which is a coarse-fibrous connective tissue that fills a deep skin defect developed after an ulcer. Erosion is a skin defect within the epidermis. It is formed as a result of the reverse development of vesicle surface pustules. Ulcer and the scar after ulcer.